entertain U.S. presidential election predictions, or we could save that to the end if you like. But on a more serious level, here to, I guess, share some words about the Premier's press conference today. You know, I, like many Manitobans, I like to volunteer, I like to help out, I like to walk with the Bear Clan. But today, as much as I like hearing about Manitobans volunteering and helping out, when the Premier does it during the worst crisis we've faced in generations, it seems almost as though he's trying to take advantage of that good nature that Manitobans have, especially when we have such an urgent crisis in ICUs and there's so many small businesses who are asking for more support. It just seems like the Premier's trying to get away with not spending any money, still trying to earn some positive media coverage, but not actually stepping up with those kind of direct actions that are going to help make the pandemic a little bit easier to make it through for all of us here in Manitoba. You know, there are people out there who could be hired right now. Why isn't the government hiring them? Why is the government putting out a call for volunteers in healthcare rather than just hiring people? Why, after years of cuts to healthcare, is the government just asking for people to volunteer to come back? It doesn't make a whole lot of sense to me. I think when we look at the fact that we're facing the most serious crisis that we've been in for generations, we all got to recognize, and the Premier more than anyone has to recognize, we're not going to get out of this situation on the cheap. We need investment, we need hiring, and we need a stronger response than we've seen so far. So that's my opening statement, and I'm happy to dive into further specifics if there's things that you want to discuss.
Just about the Incident Command Center. The Premier said it really never went away. It was just sort of rebranded as a respiratory virus, something else. And we asked him if it was still in place and still in action, then how can we have cases exploding at personal care homes and hospitals? Why wasn't it able to step in and stop that or nip it in the bud? And it just was not something that we should be blaming health leaders for. What do you say to that?
It seems like the Premier hit the snooze button when it came to preparing for the second wave of the pandemic. Everyone warned that there was going to be a second wave and that it was going to be worse than the first wave. I think that the government is showing through disbanding the incident command structure and through other comments that they've made over the past couple of days, this government has shown that they wasted that time they had this summer to get rid of to get ready for the second wave. They wasted that time. We should have been preparing all along the summer. The Premier yesterday said that expanding testing capacity and contact tracing capacity this summer would have been idiocy. No, every expert was saying we should have been getting ready during that period. Again, it's a similar thing with disbanding the incident command structure. Having that in place over the course of the summer, it would have helped us better prepare for the second wave. The fact that they're activating it now while we're in code red tells you that it's an important part of our pandemic response. But why was it, if it was so important to our pandemic response, why was it not active this entire time? Why was it not there helping us scale up and get ready? It seems like, unfortunately, it was up to physicians and ICU doctors to raise the alarm bell. I just wish that the elected officials in the Palliser government, starting with the Premier himself, would have been ahead of the curve instead of trying to play catch up now.
What's wrong with having volunteers? Like, the Premier was saying people want to help, Manitobans want to help instead of feeling like they're powerless and just sort of stuck at home. It might just not be a chance for them to, feel like they have some agency and some power and can do something about the pandemic.
I think it's great when Manitobans want to volunteer. I just don't think it's great when a government has huge human resource needs in the healthcare sector and they're not willing to fill those. We've heard that the greatest capacity right now, the greatest strain is in the ICU. And the real bottleneck there is the fact that we lack staff. And so the government, instead of announcing the plan to staff up and to hire people, is putting out a call to Manitobans to volunteer. I'm saying volunteering is fine. Just within the current context, it seems like the wrong move, right? We're at a critical red stage where the government needs to be acting super aggressively to increase ICU bed capacity right now. because those big case counts we've been seeing the past number of days will translate to more ICU admissions in the days and weeks to come. And again, you know, asking people to volunteer, that's good. Expanding contact tracing, that's good. But again, that's not where the Premier, the number one decision maker in the province's emphasis should be right now. His emphasis should be coming out before Manitobans. Here is our plan to expand ICU bed capacity. Here is the timeline, and by the way, here's the plan for helping small businesses to get through this very difficult period.
Isn't that what Siragusa and Roosin talked about on Friday last week about expanding beds, and this is their plan, and this is a three-phase approach to do so, as well as hires and all the rest?
You know, they talked about 3 phases, but it's unclear to me where the provincial investment is coming into place and when. So again, those are pieces that I think it's up to the Premier to spell out. And again, the Premier has yet to say, here is everything the healthcare system needs, right? We're still waiting to hear about more nurses. We're still waiting to hear about more resources for a healthcare response. Why not just come out today and say we're going to make education free for nurses in the province during the pandemic so that we can get more people into the front lines of our healthcare response? Why not come out and say, to follow up on what Lynette Siragusa laid out last week, here are the specific measures, dollar amounts, investments, and timelines that our government is committing to. We're in a critical situation, and I think that one of the things that would reassure Manitobans is just a complete mastery of the facts and disclosure of the plan ahead on the part of this government's leader. Instead, we haven't really been seeing that. We saw first the Premier trying to blame Manitobans, and then, second, he's, asking Manitobans, the same Manitobans, to step up and volunteer. Again, he's free to say what he likes. I'm just outlining, if I were the Premier, I think these are the steps that we should be focused on.
You talked a little bit more about his public engagement plans for a number of different issues, specifically around enforcement and around curfews. What's your response to that? I know he brought it up a little bit yesterday, talked about it quite a bit more today. What's your response to that, especially when it comes to Engage MB and some of the responses they've already got?
Well, I think that bringing Manitobans along is an important part of ensuring that public health orders get observed and abided by. But the measures that we're talking about here are things that should have happened weeks ago, and delaying it under the guise of further consultation by another week or more is just going to increase the number of COVID cases that we have to grapple with later. And what physicians in the ICU and in that letter signed by 180 doctors have been telling us is that we don't have an extra week. We don't have more runway. The situation that is going to hit ICUs in 10 days to 14 days from now, it's already been predetermined by the case counts that we saw over the weekend. And so again, we need a really, really strong public health response. We need a really, really strong investment also to ensure that there's all those resources there to scale up. Flex up is the term I guess we're using now for the ICU bed capacity. And we also need a really strong response to help small businesses who are going to be hit by these stronger restrictions.
Enforcement has been a big issue. Last week, 3 tickets on 601 calls. I think 11 warnings were given. What's the issue with enforcement? Why are you seeing it fall so short, with so few tickets being handed out or fines being handed out?
Well, I think it just comes down to a lack of prioritization on the part of the government. Again, given the situation that we're now in with the case counts and the concerns about ICU bed capacity, we're not going to get out of our challenge in the ICU by handing out tickets on the street. The time for a strong enforcement response was a month ago, was during the summertime, right? What we need now is focus on the ICU. We're not going to get out of this current challenge by handing out tickets on the street when the real crisis that we're facing right now is in the ICU and it's in the hospital. So again, I think it's a question of priority. And what I'm urging the Premier to do and urging the Premier to focus on is to focus on scaling up ICU capacity as much as possible, and also putting in those contingency plans on the off chance that 2 weeks, 3 weeks from now things get out of control, that we have a backup plan. We have a plan B.
103 cases today. It's better than where we've been for the last week. What are we going to do?
Well, we don't want to put up the mission accomplished banner too soon, right? Like, I think it's very important that we keep an eye on the 7-day average. We keep an eye on the rolling average. And again, with that in mind, we've seen, I guess, about 1,600 cases over the past number of days. Even more than that within the past week. And so this still is a very serious situation, a very concerning situation. Yeah. I told you, I think a week or two ago, about a guy who high-fived me on the day when we had 75 cases after a string of triple digits. Again, that proved to be an aberration. So I don't want to dash anyone's hope here today. People are feeling a little bit better than they have over the past few days when they heard the new case count. But at the same time, we have to remain clear-eyed, and we have to remain sober in our assessment of the healthcare needs that are before us in the province right now. And the fact is that we do dramatically have to really focus on ramping up capacity in the healthcare system. The other point when it comes to healthcare is, listen, with all the flexing and all the ramping up that we've seen so far on the part of the government, we're just now getting back to the level that we were at in 2017 before they started closing emergency rooms. Imagine where we'd be if we had started from that level. How many more ICU beds would we have? Right? And the reason why that's relevant today is because there is a direct relationship between how many ICU beds and what the capacity is there and what the restrictions are in place. So again, had the healthcare cuts not been implemented, had the Concordia and Seven Oaks emergency rooms not been closed, maybe we would have had a little bit more breathing room to be able to try and flatten the curve. And again, that's not just an academic exercise. I think that is important to keep in mind as you judge this government's response to this second wave of the pandemic. Are they going to keep that penny pinching, cut first and dodge questions later approach? Or are they going to turn over a new leaf and really devote the necessary resources that our healthcare system so urgently needs?
There was reference in the U.S. presidential election.
I felt like I was begging for a compliment, except I was begging for you to ask me that question. You know, I'm somebody who was lucky to work in the States for a couple years prior to entering politics, and so I did get a chance to see the country, including many red states. I believe that Americans will do the right thing today, and by that I mean that they'll elect Joe Biden. I know there's many other people out there who maybe even lean progressive, and they got their concerns about you know, Senator Biden. I feel the same way. I cringe when I hear him talk a lot of the time, but I think when it really comes down to it, the people around Biden will manage the pandemic better than the people around Trump have so far. And that, you know, I have enough confidence in the people in America that I think they see that too. And that even if they don't want to vote for Biden, they're going to vote for their mom. They're going to vote for their dad. They're going to vote for their grandma, their grandpa, and they're going to choose a leader who can help lead that country a little bit better out of their current crisis with the pandemic. So, yeah. That's what I'm expecting. The only thing is, like, is it going to be called before we all go to sleep tonight? That'll be something interesting to watch. I hope so, because if the election's called earlier, then all the other static around can just kind of calm down and disappear.